Okay, you should be host now, so you can get started.
Okay.
All right.
Okay, can everyone see this? Or did I lose anyone? Oh my goodness, I thought I lost you all. I think I lost everyone.
Oh, we just still see the squares. So you just have to choose share your screen
Okay.
on the bottom middle when you kind of hover with your mouse. What do you see on the screen?
Okay, share my screen. Okay, and
Yeah.
then, okay, there we go. Share.
Oh, yeah. Now you're good.
Okay, does everyone see that?
Yes.
Okay.
All right, you're all
Okay,
set.
let me know if you have any questions or if I'm not making any sense. And yeah, or if you can't see me, because like I said, I'm not the most computer technologically savvy person, so let me know. Okay, so my presentation I did on dermatology. Before I came to Bayou City, I spent 2 years at Gulf Coast in dermatology, so not a lot of this knowledge that I picked up was actually from there, and it's really useful because I feel like I'm able to bring that into general practice. And living here in the Houston area, allergies are pretty bad in animals, so we're always going to see skin issues. There's three kinds of allergies that we mainly see in dogs and cats. The first one is atopic dermatitis, also known as environmental allergies. The second one is flea allergy dermatitis, and then we also have food allergies. Atopic dermatitis, it's really caused by itchiness. Lots of dogs will lick their paws, rub their face. It's caused by environmental allergies such as grasses, weeds, trees, mold, or dust. Of course, we know in the Houston area we have a lot of those things. Also, environment or breed are a predisposing factor as well. Little white dogs tend to get more allergies than others, and environmental allergies are common in hot tropical areas such as Houston. It could be seasonal or non-seasonal. Every time we have a client come in or a patient come in that reports itching, I try to ask them, is it something that happens all the time, or is it something that you notice every once in a at the same time every year? So that's always a good question to know. To diagnose atopic dermatitis, we usually do an intradermal skin test, or we can also do a blood test that we send out to a laboratory. There's no cure for allergies, so it's something that a patient will have to be on lifelong treatment for. And then I have a picture here of symptoms of allergies in dogs. The ears, the skin, it's all affected. The paws, you'll notice some bronzing on the paws, especially when you see your little white dogs like the Malteses or the Bichon Frises. You'll notice bronzing on the paws. You'll notice some dermatitis around the face. The hair coat might be discolored, or there might be some bald spot. All of those are signs of allergies. Can also have atopic dermatitis in cats. It's not as easy to diagnose. The diagnostics aren't as clear cut as they are in dogs. Even intradermal skin testing in cats is not as reliable, but it still happens. The same thing, it's characterized by licking, biting, or scratching of the skin caused by environmental allergens. Also, cats can have flea allergy dermatitis, which can present as that. I think the picture I have on this cat has miliary dermatitis, and diagnosis is based on skin scraping, cytology, or allergy testing. Here's a cool picture I found of an intradermal skin test. It's really fun because you shave a patch of hair and you make these little dots and you inject an allergen, a small amount of allergen into the skin. And based on what the animal is allergic to, you'll see these reactions pop up. Um, to diagnose atopic dermatitis, this really is the best diagnostic you can do. Based on the results of this, then we can make a formulated or a customized immunotherapy, and we can include a little amount of each allergen that the pet is allergic to. Um, and that's the gold standard. The immunotherapy that would be formulated off of that is the gold standard. You can give the immunotherapy injectable, or you can do it sublingual. The dog I have here is a dog getting a sublingual immunotherapy dose. Other treatments that you can do are Cytopoint. I really like how we have that on the market because about a few years ago it wasn't really so popular. We didn't really have it. Cyclosporin, also known as atopic, it's not very common anymore, but we still carry it. Apoquel, antihistamines, or steroids are common treatments for atopic dermatitis. Also, medicated shampoos and medicated wipes are helpful as well. For example, if you have a dog who tends to lick his paws often every time you go out, and then you come inside after a walk, you might want to wipe his paws off with the medicated wipe to kind of decrease that allergen. Avoiding allergens, it's easier said than done. I do know of some clients who had to rip up their entire yard because their dog was allergic to a certain type of grass in their yard. So they had to rip up their entire yard, put down new grass. But it's easier said than done. Just do the best you can if your dog has allergies. Also, atopic dermatitis can lead to secondary infections as well, so those have to be treated as well. Flea allergy, I'm sorry, I can't talk. Flea allergy dermatitis is the second kind of allergies that we're going to talk about. It's, of course, the most easily prevented dermatitis. It's characterized by itchiness, hair loss on the lower back, the tail, the back of the thighs, and if untreated, it can also lead to secondary infections. It's really important to have every pet in the household on flea prevention because once you get it into your environment, you have to treat everything, and it can be an uphill battle trying to get that out of your house. Then here's some pictures of flea allergy dermatitis. You can see the alopecia and the inflammation on the back. Food allergies. This is the most difficult to diagnose. Usually, if you take your dog to a dermatologist, this will be the last test that they do because it can be really frustrating for a client. Like other allergies, food allergies is characterized by itchiness, sometimes around the anus. Some dogs may also have GI issues as well. So the best way to diagnose food allergies is you have to place the patient on an elimination diet. It's about 8 to 12 weeks at least. And for that, you have to put them on a single novel protein and a single carbohydrate. It has to be very strict to where you can't even give them heart guard or next guard because those are flavored. Examples of novel protein can include kangaroo, rabbit, things like that. And I'm not sure, I'm sure they have several other options now. If the patient does not get itchy during those 8 to 12 weeks, then you can diagnose it with a food allergy. Most patients will need to be on that diet for life. That can be very frustrating for the clients because you can't give your dog bacon, ham, steak. That can be all very frustrating. Intradermal skin testing is not a reliable diagnostic for allergies. It's really just for environmental allergies. For food allergies, it's not reliable. Also, pets with food allergies are more susceptible to skin and ear infections as well. Skin infections, if your dog has allergies, more prone to secondary skin infections. Skin infections are also common in pets with weakened immune systems or hormonal disorders. The most common skin infections that we see are staph infections, which are bacterial, and also fungal infection, which is a yeast infection. Signs of skin infection include alopecia, erythema, scaling, excoriations, or hyperpigmentations. And the skin may have an odor. I'm sure you know when you have a dog with a yeast infection, you can kind of smell it. The best way to treat or diagnose a skin infection is with a skin cytology. And then on the left here, I have a staph infection cytology. On the right, there's a yeast infection. And I'm sure we all know that yeast looks like that characteristic snowman or peanut shape. How to treat skin infections. Common treatments include antibiotics, antifungals, and steroids. Also, medicated shampoos, medicated wipes, and medicated sprays help. If there is no improvement or if the antibiotics you dispense don't help, it might be important to do a culture, maybe even a biopsy if there's no improvement. Also, if there's any underlying allergies that are causing the skin infection or if there's any hormonal disorders, you need to treat those as well. Otherwise, your dog will keep getting the skin infection. Hot spots, also something that we see commonly in dogs. It's also known as acute moist dermatitis. Localized areas of inflammation and bacterial infection caused by excessive licking, biting, or scratching. It can be caused by allergies, parasites, or even stress. So treatment would be we would clip the hair around the spot and then clean it, dispense some antibiotics and steroids. Again, any underlying allergies would have to be addressed as well. Lick granuloma, very common to hotspots. Lick granulomas are known as acral dermatitis. They can also be caused by anxiety or allergy, sometimes even pain. So those are things you'd have to rule out. treated with antibiotics, topical or oral corticosteroids, or anti-anxiety medications. You do a skin cytology. If the granuloma is in a certain joint, you might want to do an x-ray, make sure the dog is not experiencing any bone pain in that area. Pain can also lead to them excessively licking an area. Also, as well as with hot spots, the patient may have to wear an e-collar, otherwise it's going to be very difficult for that spot to heal. Ear infections, something we see very commonly. I think we'll probably see ear infections on a daily basis at least. Ear infections are actually more common among patients with allergies. Also, I forgot to include also hormonal disorders can also make a patient more susceptible to ear infections. As with skin infections, they can be bacterial or fungal. Head rubbing, ear shaking. Sometimes there's a smell from the ear. I'm sure we all know what a Pseudomonas ear infection smells like. Diagnosed through cytology, and if left untreated, it can lead to a hematoma, which is when the ear penis swells up, or it can even lead to a middle ear infection. Sometimes, in the cases of chronic ear infections, you may have to do a surgery where you actually have to remove that whole ear canal. And then some ear cytology pictures looks very similar to the skin cytology pictures. As we know, the little round things are the cocci, which is a bacterial infection, and then the yeast infection. And sometimes you might have a combination of the two. I couldn't find a good picture with rods, but we can have those as well, which would indicate a more severe infection. How to treat an ear infection? Well, the treatment depends on the results of the cytology, whether you have bacterial, fungal, or both. We commonly use antibiotic drops or fungal ear drops. Depending on the severity of the infection, we may have to do anti-inflammatories or steroids. If the antibiotic therapy does not work, it's best to culture the infection, find an antibiotic that will work. And then, as with skin infections, it's important to treat any allergies or hormonal disorders. Also, we do recommend if your dog is prone to ear infections, you should regularly clean the ear, maybe every once a week, just for maintenance. And dogs who regularly swim or have the heavy-eared hair or the heavy-eared dogs like spaniels, maybe more frequent ear cleanings would be beneficial. And then if the tympanic membrane is so if you have a outer ear infection and then your eardrum perforates, that ear infection can go into the middle ear and also the internal ear. The symptoms would be very similar, except with otitis media and interna, you'd see some neurological signs as well. A dog could have a tilt, nystagmus, facial nerve paralysis. So for that, as well as cytology, you'd have to do some skull radiographs, a myringotomy, or a CT scan. And that would have to mean placing the patient under anesthesia. While the patient is under anesthesia, you'd flush out the ear canal, get a sample to send out to the lab for culture. And it would take more, the course of antibiotics would be longer than it would be for an outer ear infection. You'd also do anti-inflammatories, and usually the ear drum that's ruptured it usually fixes itself or it regenerates itself. Ear mites, we don't see it as commonly, but we do see it mostly in cats. You'll notice that it has a characteristic black coffee ground substance. Same thing, it would be itchy, irritated ear. Sometimes they might have a rash around the ear as well. For that, we easily treated with ear drops and topical insecticides. Demodectic mange, we see this quite commonly in puppies, also in pets with weakened immune systems. It's diagnosed with a deep skin scrape. To check for mites, you have to do skin scrape to where you actually get blood. It has to be a deep skin scrape, or you can do a trichogram, which is where you take some hemostats and actually pluck some hair off the pet. Characterized by hair loss, erythema, and crusting, and also treated with oral or topical parasiticides. I know Bravecto is actually one that's actually proven very useful. It's a flea and tick prevention that's given every 3 months, but I know that's been very useful. I don't think we carry it at BioCity, but I think we can order it online for our clients if they ever need it. And then scabies, we don't see this very commonly either. It's a highly contagious skin disease caused by mites. Usually you'll see it in stray dogs. Unhygienic conditions. Symptoms include pruritus, red sores, and hair loss. You'd also diagnose this with a skin scrape. Treatments includes parasiticides and medicated shampoos. And ringworm. We see this Not too infrequently, but it's a zoonotic fungal infection characterized by round skin lesions with a red outer edge. The most common sites affected in dogs and cats are the face, the ear, pinna, the tail, and the feet. You diagnosed through a fungal culture or a Woods lamp, and common treatments include medicated shampoos, dips, and oral antifungals. Oh, and here's some pictures of ringworm. The Microsporum canis on the left, it looks like little canoes with lines in them. And then on the right, we have a cat with ringworm lesions. And now that we're done with the well, there's several. This is just really the tip of the iceberg. There's several more common dermatologic diseases that we see in the veterinary field, but for the sake of time, now for some less common disorders. Alopecia X, I think I've actually seen this at BioCity a few times in Pomeranians. It's an idiopathic disorder characterized by non-inflammatory, non-pruritic hair loss and hyperpigmentation of skin. Sometimes hormonal disorders can play a factor in this, sometimes it doesn't. But the breeds most commonly affected are Pomeranian, Chows, and Huskies. And to fully diagnose, you have to rule out the hormonal disorders that may be causing the alopecia or any parasites that may be causing it. The good news about alopecia X is that it's a cosmetic disorder. No treatment is needed, but sometimes melatonin can result in partial hair growth. And that's acute Pomeranian with alopecia X. Like I said, it's cosmetic, but some clients don't like the appearance. So hepatocutaneous syndrome, we saw this a few times at Gulf Coast. I don't think I've ever seen it at BioCity, but it's a rare disease that affects older dogs with underlying liver disease, diabetes, or pancreatic tumor. It's marked by hyperkeratosis of the foot pads, pruritus, and painful lesions on muzzle, ear pinna, and genitalia. It's diagnosed through skin biopsy as well as blood work and ultrasound of the liver. So what I thought was really cool is if a dog has hepatocutaneous syndrome, on the bottom picture you'll notice that that's an ultrasound of the liver and it has like a honeycomb Swiss cheese appearance. So that's what the liver looks like because it's actually a liver disease that kind of manifests its way into the skin as well. Unfortunately, dogs who do have hepatocutaneous syndrome have a poor prognosis. It's really supportive treatment, keep the pain under control, but eventually they do succumb to the liver disease. Leishmaniasis. This is something that's very rare in the United States. I was at Gulf Coast. One of the doctors I worked with at Gulf Coast Dermatology had been in the field for about 20 years, and she's only seen this one time. It's leishmaniasis. It's most commonly found in Southern Europe, South and Central America. I think the client that had it at Gulf Coast was from Spain, so that's where his dog got it from. But it's a parasite that's transmitted through the bite of a sandfly. There's two forms. There's the cutaneous form of leishmaniasis and also the visceral form. So it affects the body in two ways. It affects the skin, and it also affects the organs as well. Same thing with hepatocutaneous syndrome. Um, it includes painful skin lesions, hair loss, hyperkeratosis of paw pads, and depigmentation of the skin. Diagnosed by skin biopsy or blood test, and prognosis is guarded. Most dogs eventually get organ failure, and they pass from that as well. So a few things to remember. Allergies, there's no cure for allergies, but it's very easy to keep your pet comfortable and healthy. You have to make sure that all pets on the household are on flea prevention. Try to bathe your dog or your cat regularly. My cat doesn't tolerate that, but if your cat tolerates that and if it's okay, try to bathe it every once in a while. Watch out for any itchiness, skin lesions, or hair loss on your pet. Also, watch out for any hair lesions or skin lesions or hair loss on yourself. Every once in a while, don't forget to peek inside your pet's ears. And like I said, there's no cure for allergies, but nowadays we have several options. And I do like how there's new medications coming out all the time about keeping your patient or keeping your pet healthy and happy. Any questions? I'm sorry if I bumbled through that. I was very nervous. And so here are my sources.
That was great, Hannah. I have a question.
Yes.
What were you seeing a lot of? I mean, I guess my question is we see a lot of skin allergy issues at Bayou City, but were you seeing a lot of the same kind of things that we were seeing as far as like Cytopoint was helpful, or were you seeing those that were like Apoquel and Cytopoint weren't working and they needed the referral and getting more? Or were some people just automatically wanting to go see a
So we had
dermatologist
a
anyway?
combination of everything. We had those patients who came in and they tried everything. They tried Apoquel, they tried Cytopoint, nothing was helping, so we would end up doing cultures or biopsies. And then we also had those patients whose primary veterinarian gave them the option, like I can treat this here in my general clinic, or you have the option of seeing a dermatologist. And a lot of people would just choose to forego the general practice treatment and just come to the dermatologist. I think at the time that I was at Gulf Coast, Cytopoint wasn't available to the general practice or veterinarians, so it was something that just the dermatologist carried. So we saw a lot of that. But most of what we saw was dogs that were hopeless cases, and the clients were frustrated. The patient was miserable, and then we'd end up doing cytologies and biopsies, things that the primary veterinarian had not done.
Very cool. Thank you.
But if you guys have any questions, come see me at work and I can show you how to, like, I can maybe show you how to do a proper skin scrape or an ear cytology or a skin cytology. I know it's really hard right here to show you, but come find me at work and we can practice getting samples. Or I can even kind of demonstrate how a intradermal skin test works without shaving or poking, of course, but we can have visual aids at work.
That's
This
awesome.
was so great, Hannah. Thank you so much. It's such a great refresher for our room nurses to go back and watch every once in a while, so they can share that knowledge with their clients as well. Like,
Yeah.
these are the reasons why we do this. This is the reason why this is the next step. This is the next step. So it was so great, especially in our city and state where we see this year round. So this was super awesome. Thank you so much.
Thank you. I'll try to send the PowerPoint out to everyone because I feel like in the delivery a lot of things got garbled, but the information is on the PowerPoint if everyone wants to just kind of read it through themselves. So I can get that emailed out to everyone.
Yeah, there were like a few things on there that I'm like, what is that? Like, let me Google that, but let me Google that later. So yeah, it'll be a good one to go back on
Or come find me
and
at
just
work. I'll be at work tomorrow, so come find me at work if you have any specific questions or just to talk about dermatology.
definitely. Well, and like you said, you're such a great source to go to and be like, hey Hannah, like, do you think this is yeast? Like, do you think this is cocci? So everybody make sure to utilize Hannah's skills.
Absolutely. Are there any other questions while I still have the recording going?
Um, let's see if I'm thinking if I forgot to include something. No, I think that's it. I can't think of anything right now. But yeah, feel free to ask me questions, and if you can think of any questions later, you can find me at work as well.